Hi, everybody. Um, Thanks for joining today. I'm going to get started because time is of the essence here. If you have any questions along the way, put them in the Q&A chat box area, Q&A, and I'll get to them at the end. And the slides and the recording of this webinar will be sent to you. I'm going to have to move at a fairly quick pace, but all the references are in the slides. So if you want to go and do some reading of some of these papers, and I think you'll find many of them quite fascinating, I've provided them all for you. So this is the second webinar in a series of the Pioneers of Healthy Lifespan Longevity series. Say hello to Dr. Denham Harman, who's a PhD and a medical doctor. He is the father of the free radical theory of aging. I remember first reading a paragraph about this guy in 1976 in the nutrition textbook at the college. And it just said basically that he did an experiment back in the 50s where he took fruit flies and he manipulated their genes to increase their superoxide dismutase antioxidant levels. And their lifespan was much longer than most fruit flies. So that sort of, got my attention. And it was one of the reasons why I started to think that nutrition might be an important subject to look at. So over the years, a lot of great research has been done by him, but also others who picked up on his work, of course. So let's get started. The background on Denham Harman, quite an interesting guy, lived from 1916 to 2014, an American medical academic. In his later working years, he was a professor emeritus at the University of Nebraska Medical Center, known as the father of free radical theory of aging. And when they interviewed his family, a few years after his death, they said, what did your father actually do in terms of antioxidants? Well, the primary antioxidant that he thought was important, that he took his whole life, was alpha lipoic acid. And he lived to be 97 years of age, and he worked well into his 90s. So it certainly didn't hurt him to guard against free radical damage. He earned his Bachelor of Science and PhD in 1943 at the University of California, Berkeley. After that, he worked for the Shell Oil Company for a number of years. But he went back to school, became a medical doctor, and specialized in internal medicine in 1954 at the University of Stanford. Right after graduation, he became a research associate at the Donner Laboratory of Medical Physics at UC Berkeley. And he pursued as his main subject area the cause of aging. And it didn't take him long to discover that free radicals were important. And in 1956, he published his first paper called Aging, a theory based on free radical and radiation chemistry. In 1972, he modified his approach to free radicals and aging by suggesting that it's free radical damage to the mitochondria that might be even more important than free radical to the cell or to the DNA. So he modified that theory, the mitochondrial theory of aging, that he published in 1972 in the Journal of the American Geriatric Society. Support for his theory of aging it really comes from several aspects of research. Numerous studies demonstrate that reactive oxygen species, or free radicals induced by oxygen, increase with age, and that reducing oxidative damage extends lifespan for various model organisms, as well as the observation that increased production of free radicals shortens lifespan. So that's been demonstrated many times. We also know that a lot of radiation exposure generates free radical damage. It mutates DNA and accelerates aging and increases risk of many diseases. And we know that our bodies generate free radicals during normal physiological processes. Just oxidative phosphorylation in the mitochondria produces some background free radical exposure that we have. And even if we take high doses of antioxidants and use antioxidant IVs of glutathione or vitamin C, you still cannot quench all the free radicals in your body. You can minimize it, but you can't slow it down completely. There's always still some free radical damage going on in the background. But our current understanding of the aging process extends beyond just free radical damage. We understand that that's part of the story of how there's cumulative damage that occurs to our cells, but there's other things that sort of dovetail with that, like shortening of telomeres and cumulative DNA damage that occurs as DNA replicates. Decreased DNA repair mechanisms can be a factor. Faulty mitochondrial biogenesis, or what we call mitophagy. Decreased activity of longevity genes like sirtuin genes. Certainly the decline in major hormones is a factor. The decline in collagen and elastin as we age, that's a factor. We also decrease our synthesis of glucosamine and acetylcholine in the brain. Our immune system declines because the thymus gland shrinks and undergoes involution. So there's a lot of different factors that are sort of at play that are related to aging and disease risk, but certainly cumulative free radical damage is definitely a factor, as well as the fact that as we get older, some of the antioxidants that the body makes to defend itself against free radicals decline. So we have a decline as we get older in alpha lipoic acid, a very important antioxidant. It's also required for energy metabolism. There's a decline in glutathione. Glutathione is the most important antioxidant in the brain. It also acts as a detoxification conjugating agent in the liver. And of course, CoQ10 declines with age. That's a very important factor with respect to not just heart disease, but also free radical damage that can affect many tissues in the body because it's also an antioxidant. Melatonin declines with age, like alpha lipoic acid. Melatonin is the only other water and fat soluble antioxidant in the body. So the melatonin protects the brain from free radical damage, but it also has many anti-cancer properties, improves sleep quality, it does immune system modulation. And the body makes antioxidant enzymes like superoxide dismutase and catalase, glutathione peroxidase, but those levels are often lower as people get older, just the endogenous synthesis of these things. Numerous studies show that supplementation with antioxidants and minerals that activate antioxidant enzymes can help slow age-related processes and impact disease risk and management, as I will demonstrate on the slides that lie ahead here. But let's look at how oxidative stress occurs in the body under normal physiological conditions. Often the body's breaking down to generate energy. It's breaking down glucose down to pyruvic acid, and you make a little bit of ATP through that glycolysis process. But then the pyruvic acid is going to enter the mitochondria and become acetyl coenzyme A with the help of certain enzymes which require alpha lipoic acid, by the way, to make that conversion. Once in the mitochondria, in the Krebs cycle, remember that NAD and FAD are grabbing hydrogen electrons and bringing them over to the electron transfer chain. And as the electrons go down the cytochrome chain in the mitochondria, they release energy, and the body at that point can increase ATP synthesis for energy production. But about 2 to 5% of the electrons leak out of the system, and they interact with oxygen in the cytosol of the cell. And here we have oxygen interacting with an electron, hydrogen electron, forming this free radical known as a superoxide anion, which can do a lot of damage. But if two superoxide anions sort of attach together, they form hydrogen peroxide. And then in the presence of a transition metal like iron or copper or zinc, then it splits it apart and you get two hydroxy radicals. So the hydroxy radicals, hydrogen peroxide, superoxide anion, these things are being generated as we process oxygen to make energy. And so 90% of the free radicals that we make under normal physiological conditions are generated in the mitochondria area. This is why the mitochondria free radical theory of aging became more popular with Denham, Harman as we got older. But those free radicals in the area around the mitochondria particularly are quenched by CoQ10 and alpha lipoic acid. But as we get older, we have less alpha lipoic acid, less CoQ10. So some of the free radical accumulation starts to speed up. What's interesting to note is that in recent years, we see that low levels of reactive oxygen species are actually somewhat helpful. They actually it's like a signaling mechanism that allows the cell to differentiate and grow, and for development. Some low-level background oxidative stress is actually a good thing. It's when it becomes really excessive, when we have excessive free radical insult, that's when it starts to lead to disease processes like Alzheimer's and Parkinson's, atherosclerosis, ischemic heart disease, other neurodegenerative conditions, a weakening of the immune system, cancerous changes. So by keeping the low-level background reactive oxygen species present, seems to be highly beneficial. It's when free radicals start to really accumulate that we run into problems. We also downregulate our sirtuin longevity genes, which we can talk about in another webinar. So free radicals, when they become excessive, start to damage the DNA, the mitochondria, enzymes, the cell membrane, LDL cholesterol, making it more atherosclerotic, damages the lens of the eye, leading to cataracts, the back of the eye, leading to macular degeneration, damaging the brain in a way that's linked to dementia, neurodegenerative conditions, and as I will show you, psychiatric conditions as well. And of course, the skin gets damaged by free radicals from ultraviolet light, or even radiation exposure, causing not only wrinkling, but increased risk of skin cancer. Skin cancer is the leading incident cancer that you're likely to develop in your lifetime. Fortunately, not all skin cancer is the deadly melanoma. Other sources of free radicals include all kinds of things that we can expose ourselves to: polycyclic aromatic hydrocarbons, heterocyclic amines, nitrosamines, alcohol, cigarette smoke, all kinds of things in air pollution, radiation damage from different sources. So it's on top of just using oxygen for energy, we have these other background sources of free radicals that can really compound things and cause excessive damage and speed up age-related processes and risk of certain diseases as well. So there's all different sources of free radicals that are affecting the body, generating the free radical storm in the cell. The cell has to protect itself as much as it can by having antioxidant nutrients present. Denham Harman thought alpha lipoic acid was the main one. But as you'll see, I think it really is a whole orchestra that has to play together. And I think you need more than alpha lipoic acid. And you can, increase your free radical damage exponentially by smoking cigarettes, having a lot of alcohol, lying in the sun without any protection for long periods of time. All these things can make it much worse, of course. So the idea over your lifetime to slow down aging and risk of disease, one of the factors is to try to minimize your free radical damage and try to heighten your antioxidant defenses, as Denham Harman was suggesting, and I'll show you the research on that. So there are some great human clinical studies showing that antioxidant supplementation can have a tremendous impact on Alzheimer's, Parkinson's, Lou Gehrig's, neuropathy, macular degeneration, cataracts, hearing loss, immune modulation, improving breast cancer survival rates, helping to manage prostate cancer, protecting the skin from UV light, and also in psychiatric disorders. You go, really? Is that really true? It's absolutely true. Let me show you. So in the year 2000, the Alzheimer's Cooperative Study, they gave Alzheimer's patients 2,000 IUs of vitamin E, a very powerful antioxidant that crosses the blood-brain barrier, versus a placebo, which had nothing in it. And they showed that that because the brain uses 20% of the body's oxygen, it's very prone to oxidative stress. And you've seen studies where they've tried to tell you that taking vitamin E supplements increases risk of heart disease and cancer. Well, none of these people had an increased risk of heart disease and cancer. It's hard to believe that vitamin E is causing cancer and heart disease. It doesn't make any sense. And in these people who are very high risk, it didn't cause cancer, heart disease. What it did do is it slowed down the progression of Alzheimer's disease in this clinical study versus the placebo. So they said in 2009, they said, well, let's do a study where we compare vitamin E to standard Alzheimer's drugs. So they took almost 850 Alzheimer's patients, gave some vitamin E, 2,000 IUs a day. Some got the drug, some got a placebo, some got the drug and vitamin E. And they said, here's the results. That the group that got the vitamin E reduced their mortality by 23%. The group that got the drug, their mortality actually was increased slightly. But it doesn't mean the drugs are bad. I'm not saying that, because when they gave people the drug plus vitamin E, they got the very best results, a 30% reduction in mortality and improved overall function. So vitamin E can be used in conjunction with Alzheimer's drugs. That's the lesson we learned in 2009. And then in Parkinson's disease, a 10-year study giving Parkinson's patients antioxidants, vitamin C and vitamin E, it slowed down the progression of the disease significantly. And I will tell you that there's research, and I've had patients with Parkinson's disease, and I give them supplements and dietary advice. But when I send them to one of my medical friends to get glutathione intravenous IVs every 2 or 3 to 4 weeks, the improvement is quite significant. It really helps to stabilize their disease. Same with N-acetylcysteine, because N-acetylcysteine crosses the blood-brain barrier more effectively than glutathione, and the amount of N-acetylcysteine in the brain is the rate limiting step to make glutathione in the brain and in other tissues as well. And also CoQ10 supplementation has been shown to slow down the progression of Alzheimer's disease, as we saw in the study by Schultz in 2005 in the Archives of Neurology. So all these things these antioxidants have been shown to impact the progression of Parkinson's disease. And also studies show that people who take antioxidants of vitamin C, less of a chance of developing Parkinson's disease. So there are the links to the studies. Go and read them, and you'll see that that's really what the research is suggesting. Then with Lou Gehrig's disease, of course, a very difficult disease, but so you have an understanding biochemically of what's happening. The major implication in Lou Gehrig's disease is that the person has a faulty superoxide dismutase type 1. So there's 3 different superoxide dismutases in the body, 1, 2, and 3, and it seems to be superoxide dismutase 1 when it becomes faulty or damaged, that it increases the risk of Lou Gehrig's disease. And so that defect, and also ventral horn cells sort of dying and decreased antioxidant protection, all seem to factor into this. I'm saying that because studies have shown that as melatonin levels decline, if an animal is prone to Lou Gehrig's disease, melatonin helps to keep the ventral horn cells alive. As melatonin decreases, the ventral horn cell receptors for melatonin undergo atrophy. And then when that happens, that's when the ventral horn cells die, and that's when Lou Gehrig's onset occurs. So animal studies where you can genetically breed animals to have Lou Gehrig's disease, if they're bred to have Lou Gehrig's disease, but you give them melatonin over their lifetime, they don't develop it. They don't develop Huntington's chorea either. So melatonin at high enough levels helps to maintain the ventral horn cell melatonin receptors and keeps the ventral horn cells from dying. So they applied this recently in some studies where they gave patients melatonin with a rectal suppository, helping to improve the management of Lou Gehrig's disease. So there's some research for you to look at. Also, glutathione factors into this to help stop free radical damage in Lou Gehrig's disease, as well as N-acetylcysteine. And CoQ10 and green tea catechins to some degree have been shown to be somewhat helpful. It's not going to cure Lou Gehrig's disease, but it can help to slow down the progression. The most important thing from my standpoint is these things might actually prevent the onset, particularly maintaining your melatonin levels as you get older, because melatonin keeps the ventral horn cells intact, maintains the melatonin receptors so they don't atrophy. As long as the ventral horn cells have melatonin levels, melatonin receptors that are being stimulated by melatonin, they don't die. That seems to be the message that we're seeing in the research right now. We also see studies showing that antioxidants can be effective in the treatment of certain neuropathies. We see it with vitamin C and vitamin E and zinc, but also alpha lipoic acid, curcumin, vitamin E, coenzyme Q10. They've all helped different types of neuropathies. Studies are now showing that antioxidants help to protect the sensory organs in the inner ear from damage from noise and noise pollution and loud noises. So studies on animals and humans have shown that antioxidant supplements help to decrease age-related hearing loss and hearing loss damage from loud noise exposure. So there's the link to that if you want to read it. In fact, what they're saying is research shows that damage to the sensory cells can be prevented by antioxidants that prevent free radical damage to this sensitive organ. So you can read that. That's a recent publication. And then in macular degeneration, we saw this back in the year 2001, the ARID study. They took individuals with macular degeneration. They gave them different types of treatment. What they said was, when we give them antioxidants, it slows down the progression of their macular degeneration in ways that nothing else can do. They gave them vitamin C and vitamin E and beta carotene and zinc and copper. These are things that increase antioxidant function in the back of the eye. And then Dr. Joanna Seddon, she's saying that giving lutein at 6 milligrams led to a 43% lower risk of macular degeneration, a study published in the Journal of the American Medical Association, dating back to 1994. Antioxidants that carry higher blood levels of vitamin C and selenium and E are linked to decreased cataract formation. And one study showed that you can slow the progression of cataracts with vitamin C and vitamin E supplements. And you can't get high enough dosages from food. You need supplements to get this effect. Same with immune system function. We know that your immune system works much better when you have at least 50 micromoles per liter of vitamin C. In order to attain that, young people need up to 250 milligrams a day. As you get older, you need at least 1,000 milligrams a day to make that happen, along with 2,000 IUs of vitamin E. Because what vitamin C is doing is it's helping neutrophils, for instance, make peroxides to kill viruses and bacteria. But also the immune cells need the antioxidants to protect themselves against the peroxides they're making. So they need the antioxidant protection to spare themselves the damage from the bombs that they're creating to kill the viruses and the bacteria. And you can't get that from food alone. So all the studies basically show that, as far including recovery from pneumonia and hospitalized patients. It's all here if you want to read about it. All the different ways that vitamin C affects immune system function, and vitamin E as well, protecting the immune cells from free radical damage and helping them decrease their synthesis of the damaging prostaglandin series 2. Studies in older patients, when you give them 200 to 400 IUs of vitamin E, it decreases upper respiratory tract infections. Same with zinc. Zinc's required for superoxide dismutase 1 and 3, but it also modulates the function of many immune cells. And people generally don't get the zinc that they need over their lifetime. 30% of elderly people are zinc deficient, and it leads to all kinds of problems. Immune compromised states, decreased taste acuity, they can't see well in the dark, their lean mass decreases, decreased wound healing. You need to get at least 15 milligrams a day from a supplement. Here's all the references on that. And the same with selenium. Selenium is an antioxidant that is required for superoxide dismutase to work, which is a very important antioxidant in the body, but it also modulates the immune system. In studies in Sweden, when they give older people 200 micrograms a day, their incidence of upper respiratory tract infections is much lower. And we saw studies during COVID-19 that where you have low levels of selenium in individuals within a population, they have the worst outcomes for COVID-19. So these nutrients are really important. And then in breast cancer survivors, we see studies like this where women who are breast cancer survivors, if they have a healthy diet, that helps. But if they add supplements, it actually improves their survival and decreases their recurrence. In 2012, this is this important study called Life After Cancer Epidemiology, breast cancer survivors, 2,600 of them. And they're saying after 5-year follow-up, the ones who are using vitamin C and vitamin E supplements reduced all-cause mortality and recurrence of breast cancer and breast cancer recurrence. Same in the Shanghai breast cancer survival study. Same thing, almost 5,000 women. The ones using vitamin C and vitamin E supplements, 18% reduced mortality risk and 22% reduced risk of recurrence. How many breast cancer patients are being told this by their oncologists today? That's why you have to step up and start to give people this kind of evidence so they can make some informed decisions about it. In terms of lycopene and prostate cancer, we see higher blood levels of lycopene are linked to decreased risk of prostate cancer. And there's 6 studies where they've used lycopene, a really important antioxidant that protects the prostate gland, in the management of prostate cancer. Study 1, study 2, study 3, study 4, study 5, and study 6. I've shown this to you before in other webinars. This is very, very important stuff. And we see that there's experimental studies to show that lycopene helps to protect against cancer of many different tissues in the body. We think lung, esophagus, stomach, colorectal, pancreatic cancer possibly, breast and cervical. So lycopene is an important antioxidant. Most people don't get it at optimal levels, don't have the blood levels that would be considered to be protective. And then there are numerous studies now where you take people and you divide them into 2 groups, then you give one group, and you have a washout period where they don't take supplements for a number of months. Then you give one group antioxidant supplements like vitamin C and vitamin E, beta carotene, selenium, zinc, some flavonoids, EG, CG from green tea, some combination. And you give the other group a placebo, and then you wait, a number of weeks till it builds up in their system. Then you expose their skin to the same dose of ultraviolet light radiation, and you see the ones that got the antioxidants, less sunburn, less erythema, less inflammation of the skin, and fewer biological changes linked to skin cancer. And why is that? Because those nutrients, as they float through the bloodstream, the developing skin cells can take those nutrients from the bloodstream, from the dermis, and it diffuses into the developing skin cell. And as that skin cell reaches the skin surface, it now has a greater amount of antioxidant protection against ultraviolet light free radicals that can form inside your skin cells. And that's just what we're seeing. It's remarkable that better nutritional status of antioxidants also protects skin cells against UV light damage. And then just in February of 2023, right, just a couple of months ago, the journal Frontiers in Psychiatry said, hey, we just did a study of women who were postpartum. You'll see this in a moment, who just gave birth. And we're seeing that women who have the lowest glutathione serum levels are at the highest risk for postpartum depression and suicide. And they're saying it makes total sense because the brain is particularly vulnerable to oxidative damage from free radicals. It uses 20% of the brain's oxygen. And we've seen that oxidative damage to brain cells is linked to pathogenesis that leads to psychiatric disorders and makes the brain more vulnerable to toxic oxygen species. And the brain has a lot of transition metals to convert oxygen into free radicals. It has a lot of iron and zinc and copper, magnesium. And we see that low levels of antioxidants, melatonin and glutathione, as you get older, you have lower levels. They decline with age, but glutathione is the brain's most important antioxidant. So this is a quote from this research paper just 2 months ago. According to the results of recent meta-analysis, N-acetylcysteine, right, NAC, was moderate as a treatment now was moderately effective in relieving depression symptoms in adults with major depressive disorder, bipolar disorder, and other psychiatric conditions. Unbelievable. Further, N-acetylcysteine directly evidenced antidepressant-like effects in rodent models of depression through its role as an antioxidant. And what they showed in this particular clinical study is postpartum women with low serum glutathione were significantly more prone to suicide risk. And they also had depression, and then it became suicidal. So they're saying, we think we should be looking at glutathione levels in pregnant women and giving them N-acetylcysteine to make sure if their levels are low to get their glutathione into the ideal range. But, you know, the medical profession is not going to act on this. It's going to fall into your court to help women understand this. So my suggestion is this. Here's of antioxidant protection over your lifetime, starting at age 16. And as you get older from there, the Adiva all-in-one multivitamin already has 1,000 milligrams of C, 400 IUs of vitamin E, 15,000 beta-carotene, 200 micrograms of selenium, 15 milligrams of Z, lycopene, lutein. I put it all in there because I wanted it. I think everybody should take that unless they can't. At age 40 or 45, you would add Cardio Essentials to get that extra CoQ10. At age 45 to 50, I would take Ultimate GLX to get N-acetylcysteine, alpha-lipoic acid, L-glutamine, and selimer. They all support glutathione levels, and alpha-lipoic acid is in itself an antioxidant. And then after age 40, I like Sleepy Naturals to get that extra bit of melatonin as well. So there's the Adiva Multi. I've shown it to you before, but you see the antioxidant dose is 1,000 milligrams of C, 400 IUs of vitamin E succinate. That's the most important anti-cancer form of vitamin E. 15,000 IUs of beta-carotene, 200 micrograms of selenium, 15 milligrams of zinc, bioflavonoids, lycopene, lutein, all there. It really replaces a lot of different bottles, as you know. Here's Cardio Essentials with the CoQ10 and other things to support heart health. And Ultimate GLX with N-acetylcysteine at significant doses. These are not little just, window dressing doses. These are the real dosages that make a difference to raise glutathione. And Sleepy Naturals with melatonin, right? As you get older, you start to increase the dosage as you get older, as I've shown you in the past. So Denham Harman, he revealed the importance of minimizing free radical damage to our tissues via certain health-promoting practices and fortifying our free radical resistance using antioxidant supplementation. In today's world, we see that antioxidant supplements play a role in slowing age-related processes linked to morbidity and mortality, reducing hearing loss, supporting immune function, reducing LDL oxidation, likely decreasing the risk of certain degenerative diseases. It's been used in the adjunctive treatment of many health conditions, from cancer to neuropathy to Parkinson's and so on. Helps to protect our skin from ultraviolet light and has prevention and adjunctive treatment applications in certain psychiatric conditions. But he was the first guy to put all of this on the radar. So I think we should be very grateful to know about Dr. Denham Harman. He's the guy that first got my interest in this subject matter sort of peaked. So I want to thank you very much for attending this webinar today. I hope it was valuable. So having said that, if you're not an Adiva customer, you want to learn more about all the things that we do, monthly specials, wholesale prices, the affiliate program, all the educational materials that we have, to contact Arlene Walker at that number. She's very friendly. She'll look after you. We have a great website that supports practitioners called adivainfo.com. You can also learn about becoming a registered orthomolecular health practitioner at this website. It's a pretty extensive course, but I think it's a great course. And we have a new customer service rep named Tanya McGillis, who's fantastic. You can reach her at our 1-800 number. She will help you if you want to place an order or learn anything else. She's also a tremendous resource for us. So on that note, I will thank you. Before I take questions, I want to tell you about my brother, Dr. Paul Machino, who is very successful. He's in Richmond Hill. He has a waiting list practice, like a 3-month waiting list just to see him. He's outstanding. So he's now in his 60s. He's thinking, I think I should bring in an associate and start transitioning out, maybe someone who can take over the practice over time. He's a very nice, gentle, honest, sweet guy. If you're looking for a practice opportunity or you know somebody, you can reach him at that email or give him a call. He'd be happy to chat with you and see if it's the right fit. So back to saying thank you, and I'm going to look in the chat box to see what we have, if we have anything. Question and answer. We have somebody. Well done, Jim. Hey, thank you very kindly. I do my best. That seems to be the only comment or question that I have. Listen, I tell you honestly, I just think that this whole free radical antioxidant physiology is an underpinning of slowing age-related change and decreasing certain types of damage that do lead to degenerative diseases. Knowing that your body makes fewer of the endogenous antioxidants as you get older, to me, suggests quite strongly that it makes sense to stage certain supplements in over time the way I showed you to maintain more optimal levels and defend yourself in a way that you can't do from just eating food and living a healthy lifestyle and avoiding smoking and alcohol. I think you should fortify your system. That's my belief. It's worked. I'm very happy with what it's done for me. And so I would suggest you take that under consideration and maybe apply it. So we'll be back next month. Next month, we're going to look at the research work of Dr. William Castelli. He was one of the main medical directors of the famous Framingham Heart Study during its sort of heyday when all the risk factors for cardiovascular disease were being developed. I think you're going to really like that webinar. So I hope you'll join me next month. We'll send out that invitation. Here are a couple of questions. Can we watch this 10 more times? Yeah, we'll send it to you. Is free radical damage always silent, or are there symptoms? There's really no experience of free radical damage. There are indirect markers of free radical damage, breath pentane, blood levels of malondialdehyde, but no one does these kinds of tests. You can say to a doctor, I'd like to get my blood levels of glutathione done. Well, in the United States, they might do that. No doctor in Canada that I know is looking at blood levels of glutathione. It's very hard in Canada to convince a doctor to do some of these fancy tests, like what's my blood level of vitamin C and my blood level of vitamin E and my blood level of zinc and my blood level of selenium and what's my malondialdehyde blood level and what is my glutathione blood level. They don't do that in Canada. We have socialized medicine. They don't want to spend the money. And even if you ask a doctor to do this, unless they're an integrative doctor that have an understanding of this, they often, even if you're willing to pay for it, won't even order the test. So it can become frustrating and maddening. So there are no direct symptoms that you experience. But if you see yourself aging faster than your peers, you probably have more free radical damage. Okay, guys, I'm going to let you go back to work. Thanks again for sitting in, and I'll see you next month. Be well till then. Thank you.